Hello, my name is Darrell Fisher, and I am a medical physicist with 40 years of experience in the dosimetry and biological effects of internally deposited radionuclides. As a young student at the University of Utah in the 1970s, I studied the biokinetics and metabolism of the transuranium elements. I worked on methods employing chelating agents for clearing radionuclides from inside the bodies of contaminated nuclear workers. In radiology, similar chemical chelating agents with technetium-99m and other medical isotopes have been used for preparing diagnostic radiopharmaceuticals, the essential imaging agents widely used for many years in the field of nuclear medicine. Now, in the 21st century, we've entered the exciting era of molecular radiotherapy, cell-targeted treatment of cancer, which promises higher therapeutic ratios for improved treatment outcomes, and the ability to target and treat distal cancer cell metastases. While developments with beta emitter radioimmunotherapy agents have been gradual over many years since the discovery of methods for preparing radiolabeled antibodies, research, both clinical and preclinical, continues to promise even more interesting combinations of radionuclides and molecular delivery vehicles, some even in the form of microsphere and nanoparticle constructs. Into this world of cell-targeted radiotherapy enters the new use of alpha-emitting radionuclides with augmented cell-killing properties. The selection of therapy agents and amounts to be delivered will be guided by dosimetry to both enhance therapeutic outcomes and to guard against undesired radiotoxicities. Oncologists will need guidance on radiation dose delivered to biological targets and the implications of therapy in terms of dose distribution, dose rate, biological damage, and other measures of both short-term deterministic and longer-term stochastic effects in patients. Your practice of medical physics may be enhanced by a thorough understanding of fundamental principles of medical internal radiation dosimetry. As with therapy using penetrating radiation, the precise understanding of radiation energy imparted to organs and tissues by internally deposited radionuclides requires strong foundations in radiation physics and human anatomy. To those foundations, we must add understanding of radiopharmaceutical behavior and biokinetics, which ultimately influence metabolism, blood clearance, organ and tissue uptake, retention, clearance, and excretion. These are fascinating aspects of drug behavior. These fascinating aspects of drug behavior determine radiation dose, dose distribution, and ultimately the effectiveness of radiopharmaceuticals in diagnosing and treating disease. In lectures designed to provide the fundamentals of medical internal radiation dosimetry, an ability to perform internal dose calculations, Dr. George Skouros and I teach principles that guide our field. Dr. Skouros is professor of radiology and radiological science at the Johns Hopkins Hospital in Baltimore. He's also chair of the Special Committee on Medical Internal Radiation Dose, better known as the MERD Committee. I serve as committee vice chair. The MERD Committee develops standard methods, models, assumptions, and mathematical schema for assessing internal radiation doses from administered radiopharmaceuticals. The MERD approach simplifies the problem of assessing radiation dose for many different radionuclides, each with its unique radiological characteristics and chemical properties as labeled compounds in the highly diverse biological environment represented by the human body, the internal organs, tissues, and fluid compartments. The virtue of the MERD approach is that it systematically reduces complex dosimetric analyses to methods that are relatively simple to use, including software tools for experimental and clinical use. Radiation dosimetry provides the fundamental quantities used for radiation protection, risk assessment, and treatment planning. We hope that you will enjoy and learn from the presentations that we have prepared on medical internal radiation dosimetry and risk assessment. Thank you.